Hey guys, welcome back. My name is Sam. I'm an occupational therapist and I'm here today to talk to you about chronic pain. So let's get started. Many of you have probably been dealing with chronic pain for some time now. You've been told by doctors that there's nothing you can do about it. They keep prescribing treatment that doesn't work. So what the heck do you do? Well, one problem is that the doctors like to focus too much on the bones, the ligaments, the muscles, and joints for producing the pain. And we know that after between 3 to 6 months that these are generally healed and there's not really a good cause for what's going on. If it isn't the muscles, joints, and bones, then what could it be? But it could be this. And that's what we're going to talk about today. How the heck does the nervous system influence your chronic pain? So when we hurt ourselves or have an accident or undergo surgery or experience a lot of emotional stress, our nerves become very active. And when you have pain in certain parts of the body, the nerves kind of wake up and tell your brain about all the danger in that area. But unfortunately, sometimes in some people, these nerves take forever to calm down, and they may do so very slowly. So maybe that means that you hurt your knee a while back, like 6 months ago, and it's still giving you trouble, even though it's been 6 months, because of this gosh darn nervous system that's just like, oh, it's going crazy. Part of the root of the problem is a hypersensitive nervous system. And you can kind of think about it this way. Your nerves and your nervous system are like an alarm system of a house, right? For the typical person with no chronic pain, they might have a regular alarm system that goes off when a burglar kicks in the door, right? But for somebody with chronic pain, that alarm system goes off just when a little leaf touches the window. So how the heck do you know if your alarm system or your nerves are just too sensitive? Maybe your activity level before reaching pain has decreased a lot, or you instinctively know you are becoming more sensitive, or pressure on your skin or around the painful area is sensitive. Or when doctors and therapists tell you to move your body parts, you are so sensitive and it's painful, right? You're probably on medication to calm your nerves. So many things elevate the alarm system, such as pain after injury, different explanations for your pain, and you just feel more stressed when you're not sure about what the treatment options are that you should follow. And this doctor is giving you this explanation and this doctor is giving you a different explanation, and just getting this sense of uncertainty is unsettling and can cause more pain. Not to mention the family and job stress. You might be trying to take care of your family but unable to work, and these expensive tests and loss of work time and frustration and concerns about the money, the future, the ability to work, right? It all piles up. A few other reasons why your nerves may have remained hypersensitive is because you've had failed treatments in the past. Your brain believes that the past and future treatments will fail. Then the alarm system goes up. And so you have this fear, right? And you're fearful of injury or re-injury, and fear of exercise or movement will elevate the alarm system instead of turning it down. So all of this fear, this panic, anxiety over money, over failed treatments, all of these things pile up, and you're left with this chronic pain that's as icky as this. Now, not only will your chronic pain elevate when you have an increased alarm system, you'll know if your nervous system is having this hypersensitive alarm system if you're also sensitive to things like temperature, increasingly sensitive to cold temp and feel more aches and pains when it gets cold out, or you're hypersensitive to stress. You actually have sensors and nerves that are sensitive to stress, and the more stressed, anxious, and nervous you are, the more you will experience these annoying aches and pains. And then when you're getting even more stressed, those emotions produce even more stress chemicals, which activate stress sensors and nerves, and it's just a catastrophe and a storm. And did you know that your immunity can actually be compromised by chronic pain too? Another thing you might be really sensitive to is lack of blood flow. When your blood flow starts to slow down after sitting for too long, for example, these sensors wake up and make the nerves more sensitive. So that's the gist of it, guys. Your nervous system plays a huge role in producing the chronic pain experience. And not only that, but how you think about the chronic pain, how stressed you are, how you view treatments, how you're thinking about pain and increasing the immune response, for example. Many things can influence the chronic pain, but the key here is that you do have control. And it's not just left up to your doctors. There are things that you can do about chronic pain, and I'm going to tell you more about those in future future videos. Thank you so much for watching. Sam, occupational therapist here to give you more advice next time about chronic pain and living life to its fullest.